Blog Talk Radio.
You're about to hear a revolution in talk radio, Liberty Talk Radio, where the critical thinking will defrag your mind of propaganda-ridden viruses induced by mass media news programming. No BS here, just the facts.
And now we present to you America's quintessential iconoclastic anomaly. Wow. In talk radio, your host, Joe Cristiano.
Welcome, everyone, to Liberty Talk Radio. I'm your host, Joe Cristiano, and this is your antidote to popular talk radio. We're broadcasting from our studio in Tulsa, Oklahoma, to around the world. Folks, today we're going to have Dr. Elaina George. She'll be here in a few minutes. She had a patient, and she did call and say that she would be a few minutes late. Of course, the patient comes first. The radio station comes second. I very rarely say that. But Dr. Elaina George is a board-certified otolaryngologist. That's an ear, nose, and throat doctor, by the way. She graduated from Princeton University and received her medical degree from Mount Sinai School of Medicine in New York. As an independent solo practitioner in private practice, who is also a small business owner, which makes sense, she has a unique perspective on the problem of healthcare delivery, the true cost of healthcare, and viable solutions. And boy, do we need that today. Well, her solutions seek to improve and to restore the doctor-patient relationship, something that's sorely missing today because we've become supermarkets more. The healthcare system has become a supermarket. You come in, you take something off the shelf, and you leave, it seems. Her interest in politics of healthcare and the reform effort has led Dr. George to become both a powerful voice for the practicing physician and an advocate for the patient. She has also been honored with membership in the leading physicians of the world and Who's Who Top Doctors Honors Edition. She is a recurring medical expert on a variety of shows, including Your World with Neil Cavuto and Newsmax, and of course, here, returning guest, Liberty Talk Radio. We will discuss her new book, Big Medicine, the cost of corporate control and how doctors and patients working together can rebuild a better system. I read the entire book. It's spellbound. You have got to get this book. It is fantastic. It gives you insight, and it's written clearly so a layman can understand. There's no gobbledygook or funny language in it. Even a numbnut like me, who has difficulty sometimes comprehending what's going on around me, I understood what was being said. Now, one thing about the book, I have to admit, it does get you angry because you can see so plainly that what we have now today is not being brought about or hasn't been nurtured to care for the patient. For the patient benefit, although this is what the politicians say, it's for another reason, and those reasons cost the patient and cost health care. And of course, our health as well go with it. All right. So she will be with us in a few minutes, right after she sees her patient, and I guess I'll just fill in as we go along. There's probably very few subjects that garner the amount of emotion from people when you talk about health care. Of course, people who don't have have insurance go to the doctor, and there is some sort of government subsidy. All right, they bought into the system, and of course they're fortunate in that they're getting some sort of medical help. And so by talking against the medical system that we have today is blasphemy to them. They don't understand how people who are against today's government care, how you can be against that, because it'd be so cruel. People would suffer. And actually, it couldn't be further from the truth. You see, today, I did an experiment, and I had mentioned this once before on my program, in that I had a major operation a couple of years ago. I took all the bills, added them up, and by the way, I am still receiving bills 2 years later, and I have no idea what they're for. I just pay them because they're relatively small, $63, $125, and it's like a monthly payment that I'm making, and I can't figure them out. I don't know who to call. All I know is I get a bill from a medical organization and I pay it. Maybe I should be questioning it more, but they just never stop coming. Anyway, and I went to a cash-only hospital here in Oklahoma City, and found out how much that operation would have cost, and the cost. And then I compared it to what I had been billed and how much I was paying, and the cost was almost 10 times as much. 10 times, yeah. So you think you're getting something free, when in fact all of my co-pays and deductibles, etc., if you added them all up, I could have paid cash for that and would have saved all of that money. Of course, who would have been left out in the cold? Well, the government bureaucrats, right? The special interest groups, the pharmaceutical industry, all the people on the take on the government dole, they would have lost out. But in fact, the economy would have made out, because all that money would have stayed in the economy rather than going to people. They say, well, Joe, you paid about the same amount. Why are you complaining? Well, that's because if you read another book, we had Michael Tanner, who is the senior fellow at the Cato Institute, wrote this book, Going for Broke. And it talks about the national debt. And a major portion of the national debt, something like 70% of national debt, is for Social Security, Medicare, Medicaid, and veterans assistance and whatever. All mostly medical services provided by the government or paid for by the government. And that represents something like 70% of our debt. Now you can imagine, folks, the condition, the financial condition of this country, if that 70% did not exist. Now there's a lot of reasons why they exist today. We don't have time to get into it. But we really have to understand that nothing is free. When I was young, if someone says, hey, this is free, you were on guard. You say, well, there's no such thing as a free lunch. Remember that was a saying? You never hear it anymore. There's no such thing as a free lunch. But yet we turn on TV, and what do you hear? Oh, get this, it's free. Get that, it's free. Buy a car, it's free for the first year. Everything seems to be free. And yet when I grew up, you were warned any time something was free, you ran the other way. You knew there was a catch. And the catches have been multiplying by the hundreds these days, and it seems like everything today is free, and look at the debt that we're in. Everything is free. Credit cards, free interest for the first 6 months, and free airline miles, and free this. Everything is free. And if everything is free, folks, I have to ask a question. Why are we the most indebted nation in the world? And so we have to beware. So I like to I think what Dr. Elaina George will do is take some of the emotion out of the healthcare debate. Now, what we should do, obviously, is get the government totally out of it. Whenever, when people become doctors, of course, you always say, oh, doctors make a lot of money, they're selfish, they wouldn't give you a dime if you were dying. And it's garbage. It's garbage. Doctors take the Hippocratic Oath. Now, of course, you always find an oddball here and there in any industry. But, for the most part, if you went to a doctor and you were ill and you were dying or you had something critical, and the doctor knew you couldn't pay, he wouldn't make you die. He wouldn't make you get sick further on. She's on the air now. He would help because he took the oath to do. He or she took the oath to do that. Well, I think we do have Dr. George on the line right now, and let's get her on. Yep. Let's see. Dr. George.
Good morning, Joe. Please forgive me.
Oh, no, no, it's quite all right. I was just ad-libbing, and I was just talking about your book and about the healthcare industry in general. I want you to know it's an honor and a privilege to have you back. By the way, I read your book word for word, and I was telling our listeners about the book. You must get the book. What happened to Elaina? You lost her. Okay, there she is. But they must get the book. I want to make a couple of comments about the book before we start. I'm giving books practically every week to read, because of people on the show. And I don't get to read them all. I get to read about half of them. This one I was particularly interested in. In fact, I interrupted reading another book to finish this one. And what I enjoyed about the book is that it was easy to read. It was easy to understand. There was no language in there that I had to run to a dictionary or call a doctor friend of mine and say, what does this mean? And it lays it out so beautifully, so plainly, that even someone like myself who is not in the healthcare industry truly got to understand it. Now, the only problem that I had, and I did have one problem, is that it got me so darn mad. I tell you, I said, I shouldn't read books like this. My blood pressure can't handle it. But you bring it to life, and you make it very personal, and everyone who reads this book can identify with it and see themselves in what you are writing, and they can understand that. And that's the beauty of this book. And I do encourage all of our listeners, Big Medicine, The Cost of Corporate Control, and How Doctors and Patients Working Together Can Build a Better System by Dr. Elaina George. Please get the book. It's fabulous. You'll get to understand the system. Thank you for being on our program. Tell me, now that my blood pressure is up about 40 points, why don't you just give a synopsis of what this book contains and then some of the solutions, and then we'll get into some dialogue, okay?
Sure, absolutely. I wrote the book because I actually, you're the perfect audience for this book. It was all about explaining how we got to this point. Everybody talks about how it's broken and, doctors are trying to do procedures just to make money, but there really hasn't been anybody who's explained how it came to pass. And unfortunately or unfortunately, I have lived through the entire metamorphosis of the healthcare system, from medical school, residency. I was right on the cutting edge when HMOs came online, when the insurance companies took control and doctors, out of fear, started joining health insurance panels without reading the contract, to opening my own practice. So I've been on the front line of this, and I've been really frustrated. And there were times that I wanted to leave the profession. So instead of being negative, I decided to do something. I'm not a whiner. I want to fix this. And the only way to fix it is for people to understand. And quite frankly, the people who need to understand are the patients. You guys are on the front line. You don't know what's happening to you. All you know is you're spending more money, you're seeing less of the doctor, and everybody's telling you should love it. So what I wanted to do is really lay it out. It's not a political book. I mean, obviously you're going to get some emotional kick from it because you see how you're being manipulated.
Right.
But at the end result, it's about solutions. And it lays it out, but it also gives solutions at the end of the book so that it empowers everybody to take your power back, make decisions from a conscious point, not because someone has some telling you how bad you are because you want to control your own healthcare dollar. You're not bad. And I believe if doctors and patients actually pull ourselves out of this system, which is broken, that's the way to fix it. If we expect the Congress to do it, we're going to wait forever. But if we take our power back, power of the purse, then they'll come to us. So that's what the book is about.
Well, do you get negative feedback from those people who are the lower income, who are struggling just to make ends meet, and then you come out with this outrageous thought, of getting government out of healthcare, which of course would lower it about 90%, but they don't see it that way. They just see that a benefit is taken away, and without it, they may suffer or get ill or even die.
I don't get that, because ultimately the same people that was supposed to help are the ones it's hurting the most. They're still paying more money. The deductibles have gone through the roof. The choice of doctors has dropped dramatically, and they are still going to the emergency rooms. 22% of Obamacare enrollees have dropped out over the past year. It's not working. So for them to really understand, and everybody should understand, it's cheaper to actually pay for your health care out of your pocket than it is to use your health care insurance. That's the truth. And once people get to that mindset of having a piece of plastic doesn't keep me healthy, having an insurance card does not guarantee access to health care,
right,
then you start to make conscious choices.
Right. Well, I have many doctor friends, and I can summarize their attitude in one word: angry. They just angry. every one of them that I know would prefer to get out somehow and get out of the system that we're in. And boy, it's tough when a doctor is treating you and you know he's not happy with the system, and you just hope he doesn't take it out on you. Hang on there just till I leave. I want to live through this thing. But also, I had mentioned right before you got on the air that I did a little experiment. I had a bad valve since I was a kid, and eventually it went after 71 years. It lasted, and I had a very successful operation. And I took all the bills that come in, and they still come in. 2 years later, I'm still getting bills. I pay them. I have no idea what they're for, but they're from a medical organization relative to this operation, and your part is, and I don't understand it, and I just pay it because it's not a significant amount. It can be $50 to $150 around there, but they're constantly coming in. I have no idea how many thousands I've paid doing that. And I wouldn't know who to question if I did want to question it. But I took all those bills and added up, and then I went to a hospital. I think the hospital that you had mentioned in your book, I think it's in Oklahoma City. It's the cash-only hospital, and
Correct.
Found out how much it would cost. And now this is really rough and dirty, and I couldn't substantiate the numbers. I just got all my stuff together, so to speak, and it could be some double entries there. And this is going to sound ridiculous, but it seemed to be 10 times as much.
From the main hospital, right?
Yeah, it would 1/10 the cost if I went to a cash-only hospital. And I'm sure it's off, but I mean, I just had to ask you, how far off am I?
You're probably off by about 100-fold in terms of more money for the hospital. It's interesting. A patient came to see me yesterday. I operated on him in 2010, and I did it in the hospital. And he showed me his bill. We don't get to see the bill. His bill was $23,000 for doing a sinus case. We got $600.
Oh,
the hospital got.
Oh, God.
Okay? So this is it was itemized, and this is the degree of ripoff that goes on. The IV fluid, which is about $1.50, they charge $63 for the IV fluid.
Oh, my
I'm going to tell you something.
Oh, my God.
I know that the equipment that I use in the office is $150. They charge $600. This is what they do. And ultimately, you've got to make conscious choices, and you need to stay out of the hospital setting, because that's what's gouging people and putting them in the poorhouse. I got $600. I can tell you my office manager had twins. The OBGYN got $1,200. The hospital got $83,000. So what's the problem here?
God, oh my goodness
Follow
gracious.
the money.
So I wasn't way off then. I mean, I was too conservative, actually.
You underestimated.
Oh my goodness gracious. Oh, I'm going to Well, it was interesting. I had a lubricant placed in my knee because I have bone on one knee, and I used to be a triathlete, believe it or not. But I still bike and things like that, and it just flares up once in a while. And I never forget the orthopedic doctor, gave me a shot. I said, it was just a little injection, just took, believe me, no more than 5 seconds would be a lot, that's the whole thing was done. And I said, out of curiosity, how much does that cost? He said, $1,000. I couldn't believe it. I said, I just couldn't believe it. And now he did both knees. I said, $1,000 for putting an injection in my knees? He says, no, it's $1,000 per knee. $2,000. And I said, how much that cost? He says, probably 32 cents. I don't know. He made up some silly number. He didn't know how much it was. But it was the same proportion. It was some insignificant amount that if it was the free enterprise system, it would have been just a few bucks, and that would have been it. And
that's exactly right.
And so everyone's paying for it. So it raises my insurance cost and raises the cost for everyone else who ever sees a doctor. And I have doctor friends that are just so angry. They can't even. My primary care physician is so, and I've known him for 30 years. He's like an old friend of mine now. And he is just so angry. He doesn't consider himself a doctor anymore. He just goes and he does what he's told. And he's just so angry all the time. I mean, he's an excellent doctor. Everyone loves him. But I can see him just someday just walking out and never looking back.
Well, that's really laid out in the book, how that happened. This all started when the government started to take control of reimbursements. What people don't understand is Medicare is the centerpiece. Whatever Medicare covers, whatever charges Medicare sets for your reimbursement scale, the insurance companies work off of that. So basically, they might give you 80% of Medicare. If it's Medicaid, they'll give you maybe 15% of Medicare rate. So whatever Medicare does, that's what happens. And I can tell you as a personal story, I trained in New York at Mount Sinai, Sloan Kettering. I did head and neck cancer, pediatrics. I've had to stop doing pediatrics and any head and neck cancer case because I can't afford it. I don't have the staff. I don't have, the reimbursements are crazy. They started something called a global period where 90 days after you do a case, you can't bill for anything. So if it's a head and neck case and you're doing dressings and changing tracheostomy, it's free. How can anybody afford to stay open and do that? So the scope of practice has dropped for most doctors. They don't do what they trained to do. They don't do it as often. They've added nurse practitioners and physician assistants to get volume. And as soon as that happened, the doctor became more of an administrator. And that's not medicine.
Yeah, it's got to get you angry. I mean, if I was in a doctor's shoes, I would be so angry when I hear this politicians say, we must control healthcare cost, when the person who's saying that is the one that is creating a healthcare cost crisis. And it's the doctor who's suffering. But the inference is that, those doctors, they have to be held accountable. They need to be controlled, or they'll take all of our money and we'll all be broke. But that's the inference, and it's the exact opposite. If I was a doctor, I couldn't listen to that at all. I can't listen to it anyway. I'm not a doctor, and I can't listen to it. I would imagine listening to that rhetoric, being a doctor has got to be the most debilitating aspect of your profession.
It is, because people who go into medicine, on whole, aren't doing it for the money. They're doing it because they want to help people.
Right.
And what we've done is we didn't complain. We didn't go public with this. We just started seeing more patients, open more offices, see more patients, streamline, do anything you could to try to bring in volume so you can make the bottom line. It's come to a point now that you can't cut anymore. Basically, we've had 3/4 of our profession, two-thirds of our profession, which used to be private practice, are now gone, or they're employed by hospitals because they need to take salary.
Right.
As soon as that happens, you're right, you get a very unhappy doctor. I've never met anybody who sold their practice who's happy about it after the fact.
Yeah.
And it's only going to get worse. And, the people, I wish one of these politicians would ask a practicing doctor, not an academician, not a pundit, not any kind of, economists. They don't understand. This is not like building, widgets. We're the only profession, and I don't think I can name anybody else, who've had to deal with decreasing reimbursements while our cost of doing business has gone up.
Right. Everything
has gone up, but our reimbursements have gone down. And they were not allowed to ask for a fair wage.
Right.
And we're being told that, we just want to cut feet off, take tonsils out to make a buck. But I thought about this today. I work well over 100 hours a week. I'm on call 24 hours a day. I love what I do. But I don't want someone to tell me that I'm being greedy because I don't want to eat cat food. I find that offensive.
Right.
And ultimately, doctors, and you said something really interesting and very telling. You wonder when doctors walk into the room if they're angry and if they'll take it out on the patient. I can tell you they don't take it out on the patient. They take it out on themselves.
That's correct.
$400 a year commit suicide. And that started really ramped up since Obamacare passed. So we're losing folks because we're turning it inward. And that's a tragedy.
Well, in Washington, don't you have a contingency saying, hey, this system is anti-healthcare? And is there not a contingency in Washington saying this is all wrong? We can plainly see that the big pharma, the pharmaceutical industry, the HMOs, the government, bureaucrats are making all the money. The doctors are getting nothing. I mean, the numbers are there to look at. I mean, they're not a secret. Yeah. And can they say, this is wrong, we need to do away with all of this and not reform it? Reform it means you just move the checkers around the board a little bit differently, but you still have the same number of checkers on the same board. Don't you have any allies in Washington that are truly fighting to go back to a free enterprise system before we lose every doctor, but hopefully when we lose these doctors, they all go to private practice?
Well, yes and no. let's just be honest. The AMA, the American Medical Association, is a lobby group which does not represent the interest of doctors or patients. They are locked in with the insurance companies. They provide the codes, which everybody talks about, the ICD-9, ICD-10 codes. They were in bed with Obamacare. They wanted that. And they love the fact that this is going to a rigid system that's going to be algorithm driven. It's not that you get to think anymore. If someone comes in with a diagnosis, you plug it into your computer and it tells you what medications you're supposed to give them.
Right.
And not only that, how long it should take for them to get better.
Right.
And if they don't get better in the prescribed time, you don't get paid. I'd say the answer to the question is American Association of Physicians and Surgeons, AAPS. That is the only medical group that is in Washington that has gone to court in our behalf and has been fighting. And they're for doctors and patients. And if people go to aapsonline.org, they can read about it. There's doctors who take fee-for-service, barter. It's all about direct primary care now, so it's a cash-based practice. And the whole point of the book is to let people open their minds that there's another way to do this.
Right.
We've been indoctrinated to think it's all about the insurance companies. If something happens to you, you're going to die if you don't have insurance.
Right.
That is completely untrue.
That's right.
As it stands now, Joe, they are denying so much, so often, it'll make your head spin. We're getting letters saying, not medically necessary, experimental, not covered. I'm an ENT. We do allergy testing. That's experimental now. Are you kidding me? That's been going on for how many dozens of years? They don't want to pay. And it's a total shell game.
Now, I understand in your book you mentioned that, which really surprised me, is that only about 15% of the physicians belong to the AMA, are members of the AMA.
Yeah.
Now, that's an incredibly small amount. Isn't that telling? Isn't that the AMA saying we're doing something wrong, we have to change course? I mean, what happens when there's only 5% or 2% or 3% of the physicians belonging to AMA? How could they represent people that don't belong?
Excellent question. Again, the baseline is follow the money. If you realize that the AMA gets most of their money from their coding system and basically nothing from a membership, you understand where their bread is buttered and who they're going to work for, themselves.
Right.
So they're not representing us. They're talking about bringing in other professionals outside of doctors to try to boost their membership so they can look, viable.
Yeah.
But ultimately, they're making hand over fist money on selling their codes to insurance companies, to United Healthcare. I mean, this is a complete cartel at this point.
Yes, I say.
They don't have to follow antitrust. They can collude with each other and set prices. Even the pharmacies, and it's all the same. It's the same game. You take over the market. You give largesse to your friends. And I'm going to give you an example about pharmacies, for example. There's something called a pharmacy benefit management company. That's a connection between the pharmacies and the insurance companies. They get together and decide what's going to be on the formulary, what gets covered. They also now are linked in with certain pharmacies, so you have to go to a Rite Aid or a CVS. So all the independent pharmacies are being locked out because they're not part of the system. And it rotates. Whatever they want to feel like making the formula this week is what they do. I mean, it's not about how good the medicine is. I can tell you, when I used to take Medicare and Medicaid, it was the worst time in the world trying to get a good antibiotic or a good nasal antihistamine spray for our patients because they weren't covered. They would cover something that was about 20 years old, maybe. It's just ridiculous. So they're playing games. It's all about them keeping the money in-house. And bottom line, it's about control. They want to control 1/6 of the economy. They want to control your healthcare choice. They want to control how much doctors make. And as soon as doctors become employed, they lose their autonomy. I know you talked about your friend. He can't see a patient and say, you know what, I won't charge you for this visit, or I'll give you a discount. If he's working for the hospital, they will flag that.
Oh, right.
Can't do it.
Yeah. You see, my wife's an audiologist in private practice, and she used to take Medicaid, and she realized how bad the system was, and she wasn't against Medicaid or anything like that, but the way even people were manipulating Medicaid to get paid to paid. And I'm going to tell you a very sad story. My wife has two offices, one in a town that's about 55 miles from here. And this woman made an appointment to see my wife, and she's on Medicaid, and I took it. And then I noticed the telephone number was the exchange of the office in Pryor. I said, "Oh, you're so lucky." I said, "My wife has an office right down the road from you." And she said, "Oh, I know that." I said, "Okay, well, I'll schedule you," because I was helping my wife at the time when she first opened up the practice. I said, "I will make the appointment for you prior." She said, "Oh, no, don't do that." I said, "Well, can I ask why? I mean, you're right down the road." And she said, "Because if I get if I have the appointment in Pryor, that means I have to walk there or get a ride there or drive there." She said, "If it's in Tulsa, they will provide me a van from Tulsa with a driver to pick me up, bring me there, wait for me, and then bring me back." And I this is the God's honest truth. I thought it was a joke. I was waiting for the punchline, and it wasn't a joke. I told my wife, and she says, and that was the last day she ever took Medicaid. Now, if someone comes to her and they don't have any money, she never turns anyone away. She will help them every way she can as if they were a paying person, and if they want to pay her something, that's fine. They want to bring her a dozen eggs, that's fine. I mean, and that's the way it is. And it's worked out perfectly, and we bypass the system altogether. But she's in private practice. She can do that.
She probably gets more money by taking the bartering than she would from Medicaid.
Yes. Oh, yeah, there was very little in it. Yeah. Yeah, when you see the deductions and all that, and then the net, what she gets, and the paperwork we had to go through. I said, you know what, when she set up the practice, I was helping her with it because I have an occupation health testing company as well as other things, and I was just filling in, And I said, this is insanity. The paperwork was unbelievable.
Yes.
Anyway, so she does everything on a cash basis. And believe me, and if someone came to her and said, "I can't hear, I have no money," she'll make them hear. But people don't believe that.
Well, that's the thing about running your own ship. You know your bottom line. I give more free care because I want to than some insurance company denying me and telling me that my services I'm not worthy.
Right.
And it would happen across the country. It's a ripple effect. Doctors used to do that, used to barter, used to have a sliding scale. And I have to tell you, the good news is it's coming back.
Oh, that's great. Yeah.
There are doctors like myself who are deciding, I really can't play this game anymore. I've tried. I've been dropping out of insurance companies as they treat me poorly. I'm leaving. And I'm much happier.
Yeah.
And it's about the patient once again, your privacy. All those things are actually being lost in this system. I know we talked a bit last time, I think, about meaningful use, which is not new, but it's part of the Medicare electronic medical record guidelines. You actually have to ask certain questions of patients in order to close your electronic chart. And they've gotten so ridiculous. I mean, if you're a pediatrician, you have to ask the mom and the child if the child thinks it's a boy or a girl. I mean, this is an agenda. That's what I'm thinking. Or if you have a gun in your home, how many people live in your home? Have you ever tried to hurt yourself? If you're an ENT, those are not questions that you need to ask somebody, maybe a psychiatrist. But this is all collection of data. It goes into a cloud. It gets sifted through. They know what medications you're on. They know what your diagnoses are. They know where you live, what's in your bank, all these things that you wouldn't think that some entity knows.
That's right.
And could hack, by the way.
Yeah.
So, I mean, it's become no longer about medicine, about data collection and population-based medicine, which is a disaster.
What I find so disturbing is that if a doctor deviates from the rules that some bureaucrat had promulgated somewhere down the line, and it could be something obscure, the doctor could actually be placed in prison and not only lose their license, but be placed in prison for trying to help somebody else out. I find that absolutely maddening. It drives me nuts when I think about things like that. But your book bears that out.
It does. And, this is how crazy it is. You can undercharge somebody. You don't want to overbill them. You're afraid to do that, so you charge them less. That's fraud. That could put you in jail.
Yeah.
That's when I left Medicare. I'm like, I can't win this. They're going to come after us and just decide I can't go there. So I left it based on that. It's a chilling effect on delivering healthcare. You're so afraid to look left or right. When they tell you to start pulling plugs on patients, doctors are going to do it because it's the algorithm. you have a disease, you have a certain age group, the prognosis is X, so you have to cut the cost. That's the next thing coming. As soon as they believe they get us all in this system, then the ratchet is going to, or the hammer is going to come down, because it's not sustainable. There's not enough money in the system. There's not enough. Only 9 million people have bought into the Affordable Care Act. 9 million. But they blew up the entire healthcare system for 9 million people. It's chaos. But I believe it's all about single payer.
Yeah.
And we're actually seeing it because the government is paying the insurance companies, whether they win or lose. They're going to become administrators of what the government wants. And that, by definition, is single payer.
Yeah. Doctor, could we just stop, take a 1-minute break, please? Could you hold
Sure.
on with us, please? I
Sure.
have some questions for you. Please don't go away. Thank you so much. Folks, just don't go away. We have a very short commercial. We'll be right back. Thank you.
You're listening to Liberty Talk Radio. Political talk derived from a historical perspective. Not always palatable, but good food for thought. Pure libertarian talk with host Joe Cristiano. LibertyTalkRadio.com.
Express Test is your go-to company for on-site occupational health testing services. That's right, we said on-site. That means we will meet you at your facility for a free health and occupational safety consultation. Express Test specializes in hearing conservation, respiratory protection, and employee safety. We can help you establish viable programs tailored to your business and employee needs. For your free consultation, call 918-743-2929 or visit us at expresstest.com. That's 918-743-2929 or expresstest.com. Do you find yourself asking, what did you say? Aaron Cristiano of Ranch Acres Audiology has over 25 years of experience helping patients just like you.
Hearing requires conservation. We need to be aware and we need to be responsible for our own hearing health.
Understand more with a little help from Ranch Acres Audiology. Call 918-749-7711. That's 918-749-7711 to learn more. We'd like to thank attorney Constance Squires for her support of Liberty Talk Radio. If you want a comprehensive way to affordably avoid legal issues, call Constance Squires. For a free consultation, call 918-254-9283 or go online at isthyWillDone.com.
Steve Harden of the Harden Insurance Agency has over 30 years of experience designing family insurance protection, including retirement planning. Call 918-488-0024 or go to hardenagency.com and request a free in-depth estate and retirement evaluation. We look forward to earning your trust and helping you meet your life goals.
This isn't your typical talk radio show. This is Liberty. Liberty Talk Radio.
Folks, with us today, we have Dr. Elaina George. She's an otolaryngologist. She's a patient advocate. We're talking about the healthcare system. Please do join us. If you have any questions, you may call in during our live broadcast, 646-652-4620, 646-652-4620. Remember to dial 1 so we know we have callers on the board. But if you want to ask a question or make a comment, just dial 1 and now a little marker will come up and we know you want to be on the air. Dr. George, thank you for staying with us. I think you're still there. I only see myself on the screen. She's there, okay? There you are. I only saw myself, you know. Well, Congress. There must be a number of people in Congress, and if not all of them, who recognize the true problem. Now, many will deny it for political reasons, but there's got to be a contingency saying that Dr. George is absolutely correct. Are there? Who are they? And what are they doing?
I don't know of any.
Oh my goodness! Oh, I'm going to jump out a window now. You know, good thing things are still shut. I'd be jumping out right now.
Well, it's. I don't know what happens. They get into Congress and then it becomes my good friend and all the status quo. Nothing changes. It's just this rhetoric to try to get you to give to the next campaign. If they really, really wanted to make a change, Obamacare is so cemented at this point. Repeal and replace it's not valid anymore.
That's what they're saying. They're saying, yeah, we have to modify it, we have to change it, we have to revise it. I don't see that at all.
No, the easiest thing to do is to repeal the mandate.
Right.
That's all you have to do.
Right.
And if people want it, they can stay in it. If people don't want it, they can run screaming out of it and let the free market reign. And I can guarantee you that'll kill Obamacare faster than you can say boo.
Right.
And that'll be a natural way to do it.
This election coming up, especially with Donald Trump, although I don't agree with him, I love listening to him. He's fun to listen to. I don't agree with everything he says, but is he an advocate of replacing Obamacare or the Affordable Care Act with a free enterprise system? Do you know of?
He's mentioned it initially. I mean, historically, I think he's for single payer, which he's now rescinded. So he's mentioned repeal and replace. No one's really talking about free market alternative. All they're talking about is health savings accounts and tax credits.
Yeah.
Like those are the end all be. I mean, let me just break that down because I want people to understand that they both mean nothing. Okay, a health savings account is where you take your money, you put it with your employer, they contribute, and you have a pot of money that you can use for your health care needs.
Right.
What people don't understand is that it's actually administered by an insurance company. Aetna, Cigna, whatever your employer has their insurance, that is the final arbiter of your health care dollar spending. So if people come to see me and I think, hey, you need a CT scan of the sinus, we have to go and get a pre-certification from their insurance company. If we get denied, they cannot use their health savings account money and just say, okay, forget insurance, I want to pay myself. They can't use the money. So ultimately, the insurance company becomes the arbiter, the decision maker for your healthcare dollar. Do you really want your money locked into a system which is working against you? Yeah. That's not the answer.
Right.
If you were able to use that money for any healthcare need, if you want a breast implant and it's your money, then so be it. You can't do that. So for me, health savings account's a joke. So I'm not a fan of that. The next thing is tax credits. I think Governor Walker has a $900 tax credit for an individual, $3,000 for a family. When you consider how much the average insurance plan is, it's laughable. So it's about $12,000 a year for an individual, about $24,000 and rising for a family of four. Tell me how $3,000 is going to make a difference in your bottom line.
Right.
It's a joke. It's just making you think that you're getting something back, but it's a drop in the bucket. You can't even afford to pay your deductible. That's usually about $2,500, maybe $6,000. And I'm seeing people coming in with $10,000 deductibles. That means they have to put out $10,000 out of their pocket before the insurance kicks in the first dime. So when they start talking about tax credits, don't be fooled that that's going to make your healthcare costs reasonable.
Well, where do the people who are unfortunately unemployed, the economy is still lousy as all get out. I mean, that's my forte is the economy. I mean, our economy is sort of our healthcare system. We make it look good, but it runs bad. And our economy is in the same boat. It's very, very shaky. There are 94 million people out of the workforce. Many people are on some sort of government assistance because they have been unable to find a job or even find a job that would pay near what they need to pay their rent. What happens with these people who are not working? How does the healthcare system, how do they fit in the healthcare system? Are they out of the system altogether, or do they get all these benefits for free, and then the working class, so to speak, people who are working, sort of subsidize it through their premiums?
I'm going to answer the bigger question first. In my opinion, and the way this is rolling out, it's a transfer of wealth, but not from the rich to the poor, from the middle class, the working class, to everybody. We're paying taxes on your insurance plan. If you have a good one, they're going to tack on 25% surcharge. That's coming. You're not getting subsidized, so you're paying for somebody else. And ultimately, you're being put in the poorhouse. As far as the people in the lower, rung of society economically, they're carrying a card that they can't use. So they have the Affordable Care Act card. I'll give you an example. We have something in Georgia called Blue Cross Blue Shield Pathway X. I know these names are like ridiculous. So the person has, they have these $500, $600 deductible, but nothing's covered. So you actually are screwing over the people in that section of the society as well, because they're carrying a card that, one, people don't take, and two, nothing's covered. So nobody's benefiting from this except the insurance companies. Right. They are double dipping. The hospitals double dip. every time they tell you that they're seeing people for free, they're not reimbursed, you don't understand, but there's a pot of money that the government gives them to see indigent people. They're getting paid.
Right.
So they're getting that money. They're double dipping on the people who are paying cash, like yourself, who just keep paying. And then they rob the insurance companies, and they're still crying poor. I mean, the hospitals are being paid when their beds are empty. The government's paying them to keep them open. This is just a system of graft, of cronyism, of pick the winner. And the only thing that's losing in the system is free market, independent physicians, and patients who want to take care of their own healthcare dollar and needs.
What's really scary is that no one is carrying that banner who currently holds office in our U.S. Congress or our Senate.
It's true.
I mean, but it's statistically, it's almost impossible that would happen, and yet it's happening. So we can conclude from that all of the people that we've elected to office are in one way, shape, or form beholding to the medical industrial complex, and that's who they are serving, and everything else that's being done is just rhetoric. And so we cannot trust them at all. If we can't trust them with our health, what can we trust them with? The answer from my perspective is with absolutely nothing. And you think that's why Donald Trump is doing so well in the polls, because he is, although he's not for a free market health care, he hasn't come out and said that, I don't think, but he is so anti-establishment that people are gravitating towards that. And is that a good thing in your point of view?
I don't trust anybody in politics at this point. Okay. It's not what they say, it's what they do.
Right.
We've fallen into this trap for the last 6 years.
Yes.
Or longer of, I love you, I want everybody to do well, I want the middle class to grow. It's all about helping people, thrive. It has not worked out that way. It's been, and I'm going to answer your question about why Congress, in my opinion, is not doing their thing. If you look at the top 10 lobby groups that give money to Congress, most of them are healthcare related. Insurance companies, pharmacies, hospital corporation, they're all giving buku money to Congress. And whoever controls the purse strings controls the power. My premise in the book and the thesis of the book is that we control our power if we stop paying into this system. There's medical cost sharing, which is part of the Affordable Care Act, which allows you to actually take your money away from the commercial insurance, away from the government, and put it with other like-minded people. Liberty Health Share is an example. It's a libertarian-minded medical cost-sharing group. And we pool our resources. It's been around for about 15 years. Great endowment. It's nonprofit. And we get to decide what gets covered. Medically necessary. That means from cancer to dental extractions to root canals to eye surgery. And we don't have to beg. I'm paying $199 per month. I have a total out of pocket of $500 per year. And I'm covered at $1 million per occurrence. So God forbid I have to end up in one of these situations. I don't have to depend on an insurance company pre-certing, denying me, telling me it's not medically necessary and experimental. That's done. And I took my money out of a system that works against me as a doctor and as a patient. And if people knew that it existed, I believe they'd make a conscious choice. You won't be fined because it's written into the law. They thought it was just small Christian groups that were going to do it, so they just ignored it. But it's a movement, and it's growing.
Explain to me, or explain to our audience, how does a off the grid, so to speak, practice such as yours, where you're a cash clinic, how does that work? A person comes to you, and do you have to pre-qualify them? I mean, do you take everyone? I mean, how does that work?
Yeah.
Can you go just overall tell us how that works?
I have a hybrid practice, so I belong to a barter consortium, so people can barter with me, and that's one way. I have sliding scale, so if you tell me, look, I don't really have a lot of money, we'll make it work. And I also have a subscription to my practice. So for $50 a month, that covers anything I do in my office that's ENT related. Hearing tests, allergy testing, telescopic examination, earwax removal. That's nothing. So people, that's less than your cell phone bill.
Right.
But you know that you can get in. You know that I'm going to see you. You know that you're not going to have to go to an emergency room for something routine where they're going to rob you. So all those things are ways to keep the cost cheap because I own my own practice. I own my equipment.
Right.
I give a discount on my surgeries in the office. So I'm a fraction of what it would cost for going to a standard ENT in a hospital setting.
Right.
So that's one method. Direct primary care practices also exist. And by the way, I have a pharmacy. So all of my prescriptions that I write are rolled into $50 a month because I have a discount.
Yeah.
And so when they tell you that medicine costs all these bucks, I can get, for example, a 500 count of Bactrim, which is a sulfa drug, for $7. Imagine what you're paying, $10, $15, $20 because they're just gouging you.
Yeah.
We're not about that. I don't need to make a profit on everybody that walks in, but collectively with enough patience and with getting rid of the middleman, I'm doing well and I'm happy and everybody's happy.
Well, if a person comes to you, how do you qualify a person? How do you know they're not scamming you, that they're not wealthy, they don't want to pay?
It doesn't matter.
I mean, it doesn't matter. It doesn't matter. Okay, but if a person came to you and you in your own mind were convinced that this person is legitimate and can't pay, and they said, listen, I know this is going to cost $500 a week. Could I pay you $5? Promise you, pay you $5 a week for whenever. You would accept that?
We actually do have installments, right? So yeah, we do that.
Yeah.
For certain, I have to trust the person, but we do offer that.
Yeah.
So it's not a one size fits all. It's an individual, and I give a lot of free care because I have empathy.
Yeah.
I've been on the other side of this, and I feel like no charge for the follow up. Offer free services along the way. That's how it's done, and there's a real relationship between my patients and I love what I do. I get up, and when I'm seeing a patient, I'm in that room. They're the only person in the world that I'm dealing with, and it's wonderful when they're better, they feel better. You can tell when you've connected with the patient.
Yeah.
I don't want to be a conveyor belt doctor. I don't want to just sign them up for a hospice. This is what's going down. It's about get as much money as you can from the patient while they're still able to be employed, and then when they retire, get them to a hospice as fast as you can get them. That's ridiculous.
You know what's interesting? My wife does the same thing, and what people would never believe is that she very rarely writes anything off. In fact, 3 months ago, she received a check from someone who had owed her this money, and I'm not kidding you, 6 years. And
awesome.
And we were ready to write. I said, we can't keep it on, but this is too old. She says, he'll pay. And he did. He actually paid. And it's rare that my wife has anyone never, unless they pass away or something like that. And sometimes the family pays, But and we don't send any collection letters out. We have none of this thing like if we don't pay and none of that. We don't do any of that. But eventually, when they come around to it, they pay. And it seems to work. We have no system in my wife's practice, and it seems to work. And
because there's respect. There's mutual respect between your wife and her patients.
Oh yeah, and they just
know
love
that
the
she cares about. Yeah, that's the difference. Imagine if doctors were able to do that once again. The rate of malpractice insurance would probably drop. The rate of cases brought against doctors would drop.
Right.
Because there's actually a relationship. Doctors are now spending on average 7 minutes with their patient. 7. You can't even ask a question.
Right.
I remember when it started with the capitation and HMOs, you can only have one complaint at a time in the primary care doctor's office. If you had multiple complaints, you had to make other appointments to come back and go over them. Are you kidding me?
Yeah.
But you know what? It all comes down to valuing yourself. I love myself. I love my patients. I was put in a position where someone was telling me that I'm not worthy, that what I do is worthless. And I bought into that for a while.
Yeah.
And all it did was make me unhappy. I can't go any lower. Therefore, I'm going to set my own value. It's nothing what the hospitals are charging, but I'm happy. I don't need to make $1 million, but I'm not going to eat cat food either. And I'm not going to apologize for charging patients because I'm providing a service.
Absolutely. Yeah.
And I think patients now have to make the decision that they're worthy. They don't want someone who's going to write them a prescription, not look in their face, type on a computer and walk out the door. They want a doctor who's going to do what your wife does, what I do. I'm going to know your family's name. I'm going to tell you, we're going to talk about other things before we get down to business.
Yeah.
That's what patients want. Well, they're going to have to pick us. They're going to have to choose us. And this book gives you the platform so you can start seeking us out, because we're there. And there's all across the country. I've had orthopedic doctors now who are going cash basis only, ENTs, chiropractors, psychiatrists. And unfortunately, it's a two-tier system that's being created. Those of us who practice medicine using the Hippocratic Oath, patient-centered, cash basis, where we get to decide with the patient what gets covered, are moving away from commercial insurance. And the people left in that are going to do what they're told. You're going to get a lot of foreign doctors coming in because they're happy to get whatever's given because they've got a better system that they're coming from. Nurse practitioners, physician assistants are going to be the front line of care. So you're not going to really see an MD. And God forbid you have something catastrophic and it costs a lot, they're going to make you comfortable and put you in hospice. We're seeing 30 and 40-year-old people in hospice.
My God.
This is a system that's completely outrageous. I can tell you personally, it happened to one of my office staff. Her dad had a heart attack, survived the surgery. What they should have done is put a tracheostomy in, and they didn't because he had Obamacare. Then they wanted to transfer him when he was stable to another hospital, but he took a turn for the worst. And instead of putting a trach in, they put a feeding tube in, and he died of pneumonia because it went down the wrong path. This is what goes down. If you're not an advocate for your family member in that hospital, they will not necessarily be aggressive, and they won't tell you what they're doing.
Yeah.
Bioethics panels are all over the place right now.
I would imagine being a doctor, you have a very personal relationship with your patients, and with rare exception, and if they even exist, that you put yourself in the place of the patient as to what needs to be done to make this person whole again. It's a real personal relationship, probably more so than any other profession on the planet.
I'd have to say yes. I mean, sometimes you're the only person that the patient can actually let it all hang out with.
Right.
And I see soldiers twice a week for disability exams. They're a perfect example. They've been treated poorly by the VA system forever. And just that empathy of sitting, looking them in the eye, and having them tell their story. I can't tell you how many times they break down. I mean, it's a very emotional Thursday and Friday in our office most of the time. But when they walk out of there, they feel better. Somebody listened, they thank you, and they really mean it.
Yeah.
That's why I do it. And I don't want anybody, any entity to decide that, hey, you're spending too much time with that person, get them in, get them out, set them put them on some medication. That's not what medicine's about. It's about healing.
Right.
And half of it is listening and sharing energy with the patient and actually communicating.
Yeah.
This system is not built on that. It's built on a drug-based system. It's not about health. It's about how many drugs you can write.
And for all the good work that you do, you're demonized.
Well, I don't care. I know what my intention is.
Yes.
I mean, we need to stop caring about what people think.
Yes.
Who want ill for us. They want to kill the medical profession. They want us to go away, shut up, and write prescriptions all day long. That demonizing means nothing. God's in the head of my life. And I love what I do. I was put on this earth to do this, I believe. I love it. And nobody's going to take it away from me, not without a fight.
That's wonderful.
So for me, everything I can do to go completely cash-based, where patients who understand and love themselves will come and see me, and we'll practice medicine the old-fashioned way. Right. And it'll be a heck of a lot cheaper.
When I make the big time, I'm going to build a cash-only hospital, and I'd like for you to be on the board of directors. Would you agree to do that?
Count me in.
Okay.
I'm with you.
All right. We have about 2 more minutes. I'd like to leave the 2 minutes to you to wrap things up, Doctor. Thank you so much.
Sure. I really thank you for having me on today. I think one of the things that makes the healthcare system stay the way it is broken is lack of knowledge. And if people understand how we got here, then they can figure out how they can get out of it if they want to. And the last chapters of the book is all about resources, choices you can make. I talked about medical cost sharing. There's also supplemental insurance like AFLAC, where you can actually spend a fraction. We're covered at $250,000 that a check will come to us, my office, myself, if we ever have a heart attack, stroke, God forbid, a cancer diagnosis. You can't beat that. $14 a month to get that coverage.
Right.
So all those things that you can do that are reasonable is all about why I wrote the book. I want people to be empowered. I want doctors to realize you don't have to take it anymore. For example, medical cost sharing pays the doctor 150% of Medicare for office visits, 170% for any procedure. That trumps anything that the insurance company is ever going to pay you.
Right.
No pre-certs, no begging. And if you actually get your patients to change off to medical cost sharing, you can keep your practice open. If you go direct primary care where you have a subscription to your practice, people are paying $2,500 out of pocket, $6,000. If you give them value for their money, they will come to you.
Yes.
So it's all about, it's been built. People just need to know so they can come.
Yes. I guess everyone should really get the book. And the reason why I say that is I'm not promoting the book so much as that I'm promoting what is in the book, and it'll make you realize the extent to which our healthcare system is broken and what can be done about it. Big Medicine by Dr. Elaina George. Please do buy the book. And where could they get the book, Doctor?
They could get it on Amazon.com. They can get it on Kindle. And they can go directly to my website, drelainageorge.com.
Okay, fine. Doctor, I'd like to thank you once again for being on our program, and I do hope that you will accept our invitation to return at a later date.
I can't wait.
Okay, thank you so much. Bye-bye now.
Thank you.
Folks, this is the end of today's broadcast. We'd like to thank our sponsors for the financial support, and we'd like to thank you for listening in. You can further the cause of liberty by recommending this program to your friends, and let us hear from you. Our email address is comments@libertytalkradio.com. Remember, as my wife would say, you are either allowing your liberties to be taken away or you're striving to protect them. Unfortunately, folks, there is no middle ground. Until next time, this is Joe Cristiano. You've been listening to Liberty Talk Radio. Stay well. Stay tuned.